What is coronavirus? The coronavirus is a disease caused by a newly discovered coronavirus. There is currently no vaccine to prevent coronavirus disease. Most people infected with the COVID-19 virus or coronavirus will experience mild to moderate respiratory illness and recover without requiring special treatment. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are close in contact with one another within about 6 feet. The virus spreads through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or nose of a person who is nearby or possibly be inhaled into the lungs. Steps to prevent contamination. Wash your hands often with soap and water. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue, then throw the tissue in the designated biohazard trash can. Avoid close contact with people who are sick. Get your flu shot. Clean and disinfect frequently. How to protect yourself. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Proper hand washing technique. Step 1. Wet your hands with clean running water and apply soap. Step 2. Lather your hands by rubbing them together with soap. Lather the back of your hands, between your fingers, and under your nails. Step 3. Scrub your hands for approximately 20 seconds. Step 4. Rinse your hands under clean running water. Step 5. Dry your hands using a clean towel or air dry them. Do not dry your hands on your pants or on your clothing. How do you know if you or someone else has the coronavirus? Symptoms may appear 2 to 14 days after exposure. The symptoms include fever, cough, or shortness of breath. Emergency signs for the coronavirus include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. Please consult your medical provider for any other symptoms that are severe or concerning. How do we protect others? Stay home if you're sick. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the designated trash can for biohazard materials. And immediately wash your hands. Wear a face mask if you are sick. You should wear a face mask when you are around other people, sharing a room, or while in the car with other people, before you enter a healthcare provider's office. If you're not able to wear a face mask because you are having trouble breathing, then you should do your best to cover your coughs and sneezes. People who are caring for you should wear a face mask if they enter your room. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. Clean and disinfect frequently touched surfaces daily, like tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and pens. Most common household disinfectants will work to disinfect surfaces that are contaminated with the coronavirus. To make a household disinfectant with bleach, use 5 tablespoons or 1/3 cup of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. Check to make sure your cleaning product is not expired. Never mix household bleach with ammonia or any other cleanser. Unexpired household bleach will be effective against coronavirus when properly diluted. You can also use alcohol solutions, but make sure your solution has at least 70% alcohol. When cleaning hard surfaces, such as a countertop, a phone, or a table, make sure you wear disposable gloves. Gloves should be discarded after each use. If the surfaces are dirty, they should be cleaned using a detergent or soap and water prior to disinfection. When disinfecting soft surfaces, such as carpeted floor, rugs, and drapes, remove visible contamination if present and clean with appropriate cleanser for use on these surfaces. For example, when cleaning the carpet, use a carpet cleaner. If you are able to put the soft surface into the washing machine, such as a small rug or drapes, wash it with warm water. When disinfecting clothing, towels, linens, and other items that go in the laundry, wear disposable gloves when handling dirty laundry from an ill person, and then discard the gloves after each use. If possible, do not shake dirty laundry. This will minimize the possibility of dispersing virus through the air. Avoid holding the laundry close to your body so that you do not get your clothes contaminated. If possible, launder items using the warmest appropriate water setting for the items and dry items completely. Clean and disinfect cloth hampers according to the guidance above for hard surfaces. If possible, consider placing a bag liner that is either disposable or that can be laundered inside of the laundry basket. Pinch and hold the outside of the glove near the wrist area. Peel downward away from the wrist, turning the glove inside out. Pull the glove away until it is removed from the hand, holding the inside-out glove with the gloved hand. With your ungloved hand, slide your fingers under the wrist of the remaining glove. Do not touch the outer surface of the glove. Peel downward away from the wrist, turning the glove inside out. Continue to pull down and over the inside-out glove, being held in your gloved hand. Now, if there is a lot of fluid on your hands, on the gloves, make sure you're taking your gloves off on the inside of a garbage can so that it doesn't splatter all over yourself and all over the wall. A good way to practice taking off gloves is to put on gloves, cover them with toothpaste, take the gloves off, and then smell your hands. Did you take off your gloves the right way? If not, your hands will smell like toothpaste. Who is high risk for contracting the coronavirus? People who are 65 years and older, people who live in care homes, other high-risk individuals include those with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised or are receiving cancer treatment. People of any age with severe obesity, underlying medical conditions that are not well controlled, such as diabetes, kidney-related illness, liver disease, or pregnant women might also be a high-risk population. Most people who get sick with the coronavirus will have only mild illness and should recover at home. Care at home can help stop the spread of the coronavirus and help protect people who are at risk for getting seriously ill. If you are caring for someone with coronavirus, monitor their symptoms and know the emergency warning signs. If they are getting sicker, call their healthcare provider or 911 and notify the dispatch personnel that they have or are suspected to have the coronavirus. The emergency warning signs for the coronavirus are fever, persistent pain or chest pressure, bluish lips or face, shortness of breath. To prevent the spread of germs when caring for someone who is sick, have that person stay in one room, away from other people as much as possible. If possible, have them use a separate bathroom. Avoid sharing personal household items like dishes, towels, and bedding. If face masks are available, have them wear a face mask when they are around people, including you. If they refuse to wear a face mask, you should wear a face mask when you are in contact with that person. When caring for someone with coronavirus, make sure you wash your hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth. Clean all surfaces that are touched often every day. Wash laundry thoroughly. Wash your hands immediately after removing gloves. Provide symptom treatment. Make sure the sick person drinks a lot of fluids to stay hydrated and rests at home. Administer prescribed medicines to help with symptoms. For people, most symptoms last a few days and get better after a week. Managing stress and anxiety. The outbreak of coronavirus may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and your community stronger. People who may respond more strongly to the stress of a crisis include older people and people with chronic diseases who are at higher risk, children and teens, people who are helping with the response to the COVID-19, like doctors and other healthcare providers or first responders, people who have mental health conditions. Things you can do to support yourself include taking a break from watching the news. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, meditate, eat healthy, exercise, and get plenty of sleep. Avoid alcohol. There are things you can do to reduce stress reactions. Acknowledge that stress can impact anyone. Learn the symptoms, including physical, fatigue or illness, and mental, fear, withdrawal, and guilt. Allow time for you and your family to recover. Create a menu of personal self-care activities that you enjoy, such as spending time with a friend and family, exercising, or reading a book. Ask for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and patients, as you did before the outbreak. When to end isolation. People with coronavirus who have stayed home and are home isolated can stop home isolation under the following conditions. If they will not have a test to determine if they are still contagious, they can leave home after these 3 things have happened. 1. They have had no fever for at least 72 hours. That is 3 full days of no fever without the use of medicine that reduces fevers. And 2. Other symptoms have improved. For example, when their cough or shortness of breath have improved. And 3. At least 7 days have passed since their symptoms first appeared. A person that will be tested can leave home isolation after these 3 things have happened. 1. They no longer have a fever without the use of medicine that reduces fevers. 2. Other symptoms have improved, for example, when their cough or shortness of breath have improved. And 3. They received 2 negative tests in a row, 24 hours apart.